Alright everyone, gather around because what I'm about to show you today is something that genuinely matters, something that touches real lives in real communities across Ebonyi State. So is it safe to say Ebonyi State is the only state or one of the top states that has decided to take healthcare seriously in Nigeria? Because coming to Ebonyi State, the way and manner in which the Ebonyi State governor has shown high interest in making sure that lives of Ebonyans is main priority. Okay, so here's the gist. Massive hospital equipment, and I mean truckloads of essential medical tools, has just landed in Abakaliki, and this is it. And this isn't for one hospital or even 10. This is equipment meant for 171 primary health care centers across the entire Ebonyi State. Now, if you ask me, that's huge. Now, this delivery did not just fall from the sky. It's part of a deliberate, structured plan by the governor of Ebonyi State, His Excellency Right Honorable Francis Nwifuru, someone who has been very vocal about revamping the state's health structure from the ground up. And the man who received the consignment, Dr. Sabino Zwibo, the governor's special assistant on primary health, gave us a very interesting breakdown that honestly puts everything into perspective. He said something simple but very powerful. He said health is seated on 4 pillars: essential drugs, human resource, structures, and equipment. And in all of these 4 components, the governor of Ebonyi State has stabilized all of them. Now think about it for a second. Most health systems in Nigeria struggle because one pillar is weak. You might have drugs but no equipment, or you have equipment but no trained workers, or you have the staff but the building is falling apart. But what this administration is trying to do is balance all 4 pillars at the same time, so the health system stands firm and not shaky. And here's the part that really impressed me. This wasn't a random procurement. It wasn't a let's buy whatever we see situation. The governor made sure the equipment was purchased based on a need assessment, meaning they went to the primary health centers, found out what each facility lacked, and then bought exactly what was needed. Plus, Dr. Nwifuru emphasized that his office will monitor the distribution and usage of the equipment to make sure everything actually reaches the right locations.
Why we are there. The governor appointed us in this capacity to help him organize and monitor what is happening in the health sector. So I want to assure Ebonyans that all these equipment will be well utilized appropriately. It will get to the final end users, because even before the purchase, we made a proposal, we collected data, we went to various health centers. We are able to itemize what is lacking in those health centers, what and what do they have, what and what don't they have. So we are able to get those records, and we wrote to His Excellency that these are the list of equipment that is still lacking for us to have a level 2 health center, because there's what is called level 2 health centers. It's an advanced form of health center. There are some list of items it's expected that these level 2 health centers will have. if you go to National Primary Healthcare Development Agency, there are list of items, list of things that are expected to be in level 2 health center for you to call that place a level 2 health center. And we made that proposal, wrote to governor. These are items needed for us to make this place, those health centers, level 2 health centers. And we're able to collect those data. Now that he has procured those equipment, we will now distribute these equipment based on the need, based on what is lacking in those health centers. Because we collected the data, we didn't just wake up and give quote items. We went around, collected data based on need, what is lacking in those facilities, and we recommended that it should be bought. Now that the governor of Ebonyi State has purchased this, we make sure that it is well distributed based on the need of each facilities. And not only that it's distributed, we have the copies, we have the list of whatever we are giving to each health centers, the OIC of that particular health center. We also have the list, even between the distribution, the WDC chairman, which is representing the area, and as well as the OIC, will come and receive the list of items that will be distributed to those health centers. And we at the ministry will keep record of all these items that we are giving them. And from time to time, in my office, as I said to the governor, my duty is to monitor all these equipment one by one, to monitor the usage at various primary health care centers. So from time to time, I will be embarking on supervision to make sure that those equipment are still there. And when we go for supervision, we always look at the list of what we supply, make sure that it is still the on-site supervision, to make sure that those equipments are there in the facilities, that it has not been sold or that it has not been diverted.